Dermatology and Laser Center of Charleston. May is Skin Cancer Awareness Month, and so that's why we're here at the Dermatology and Laser Center of Charleston. Today I'm talking with Dr. Brandon Coakley and Physician's Assistant Kalen Ashford. And today let's get right into it, because we need to talk about the ABCDs and E's of looking at your skin on at least a weekly basis.
Exactly. So there are our bodies make many different types of moles and sunspots and freckles, but the ABCDEs are a helpful way of looking to figure out which spots are troublesome. So if it's asymmetric, if it has funny borders, if there are multiple colors, if it's a diameter bigger than a pencil eraser, or E is the most important one if it's evolving over time. So we know that if you have a spot that's changing, growing, bleeding, those are the ones that you should really come in and have examined.
And don't fool yourself. Don't say, well, it looks like it, but it's probably... Have the experts come in and see you guys here and let it be turned, because sometimes it might not be anything, but if it is, early detection is extremely important. I know that on a personal basis. Early detection is extremely important for anybody, right?
Absolutely. Early detection saves lives. There are more skin cancers diagnosed in the United States every year than lung, breast, colon, all combined. So especially being in such a sunny place like Charleston, it's really important to come in and be evaluated. I don't remember the last time I looked behind my right knee.
Sure.
You know, you probably don't either.
Yes.
And so you come in here and we can be very thorough evaluation to make sure that there's nothing to worry about.
And not having anything to worry about is such a great peace of mind, especially when you come in. And sometimes you may need to do a biopsy on something just to see. There is a different type of procedure now that you're doing with the biopsy, so that you can tell just how much, if something does need to be removed, right?
Correct. So you're referring to MOHS Micrographic Surgery, and the point is that when we see these skin cancers on the surface, we oftentimes can't anticipate how extensive the roots are. So rather than guessing and outlining the cancer and then taking a hunk of normal skin around it, we can use MOHS Micrographic Surgery to only take what we need and not remove any extra skin. And on your back, there might be extra skin that you could take, but if it's on the tip of your nose, you want a very controlled, precise process that has a 99% cure rate and leaves you looking great after.
Kalen, I tell you what, you've got a great location right here off of Henry Tecklenburg Drive. Also another location over on Ashley River Road. What is happening May the 1st right here at the Henry Tecklenburg location?
So May 1st, we're having a free skin cancer screening for anyone in the community. I believe you can just call our office and we'll jot your name down, and that will be taking place here, Henry Tecklenburg. And then May 15th, we'll have another skin cancer screening at our Ashley River location.
It's so important, not only with the early detection, but using the proper sunscreen. I read so much sometimes that sunscreen, if left in the car, will start to decompose, will start to break up, and so you're just lathering on something that's not going to do any good. It's best to keep it in the right area, but also to use it properly, correct?
It is, and we can go into the details of which sunscreen is better or worse, but truthfully, I want people to use the one that they like putting on. Nobody likes really thick, greasy paste, and if you don't like it, you're not going to wear it every day. And you really, being in such a sunny location, we really should be putting sunscreen on every day. So yes, it should be broad spectrum and SPF greater than 30, but it should also be nice to put on.
And also, there's clothing that's out there now that is got a lot of great sunscreen in it as well. That's the best thing to wear. We were talking about people that have skin cancer that's on the ears because they're out in the garden or maybe doing some running. Put a lot of lather up with the sunscreen there. It's so vitally important, isn't it?
It is. I mean, sunscreen, wide brim hats, not going out at noon. You should golf, you should garden, you should go to the beach, but don't do it at noon. Get an early tea time. Those kind of modifications can prevent you from losing big pieces of your skin.
Yes. Thank you both for being here today. We do appreciate it. 2 locations, not only on Henry Tecklenburg, but also Ashley River Road. Give these folks a call for an appointment. It's the best thing to do.